Should I present the screen?
No, I can share screen if you'd like, or you can start if you'd like. You can share screen if you want. You'll start?
Yep.
Okay, go ahead.
All right. Looks like we still have people coming in, but as you know, we still have a minute actually. It's 4:59. We could wait for probably say 20 more seconds before we go on. We have like say 20 seconds for 5.
But good to see all of you today. Nice to know that so many of you all are joining in. We hope to have a very enjoyable session with all of you. So please, once we allow the comments, you can start chatting and we'll be taking questions towards the end. Saddam will take more of the questions on exercise. Of course, being the fitness enthusiast that he is. I'll be taking more of the medical ones. All right. So it's 5 o'clock. Saddam, why don't you go?
All right. Hi there. Good evening, everybody. Well, I'm Saddam, a fitness coach, right? I'm an accredited strength and conditioning coach. I'm also doing a master's in sports science currently. Also, alongside, I have Dr. Nikhil, who is, who's done his MBBS from a reputed college, which is St. John's, right? It's hard to get in there. I have a lot of friends studying there as well. Right. Also, that shows the credential that he has. So we're going to learn a lot from him. Also, that he's done his master's in psychology, so he's just not the body guy; he's also the mind guy. Which is why I also agreed to, I'm really humbled to do this with him. So yeah, guys, today basically we'll be talking about long COVID effects, right? So basically, what happened here is we were talking about how to build immunity and how to be strong for a longer duration of time after you have dealt with the infection, right? So Dr. Nikhil will be taking over from here, and he'll be starting off with the infection and how that goes about in the body. And post that, I'll be taking over and talking about the physical part of it.
Hi.
Over to you, Doctor.
Thanks, Saddam. So today I'm just going to be brief. I don't want to take too much time away from what you can actually do about it, but I'm going to explain why we chose this topic today and why it's been so important. So if you look at the body as a whole, there's generally been a lot of effects that we've seen from COVID, and COVID has been this horrible disease that's come up last year when it was really difficult for many of us. And COVID-19 has been particularly difficult because it's not just acting on our body. It's not just an infection like a common cold, right? It has another aspect of it, which is actually very dangerous for our bodies. And that is that it incites our immune system to be very reactive. It instigates it. It instigates a massive immune system, like almost like a giant war is what is instigating within our immune system. And our immune system fights back so hard that it damages parts of our body in the process. And hopefully many of us, and myself included, myself and my family, to be honest, have all recovered from COVID. And we all expect COVID, like most influenza viruses or, common colds or other things, within a week or two, we expect it to be gone and then gone for a while, like it's done. But unlike most fevers and viruses, COVID has had a particularly difficult problem. And that is that it causes something called long COVID. So that's what we're here to talk about. COVID having a long-term impact on our immune system. And what can we do about it? And I think that exercise is one of the most important things that we can do to get back to our regular state after getting COVID. And that's what Saddam is going to explain in much more detail. Being the fitness coach that he is, he'll be able to give you the best tips and practices on how to do that. But coming back to what is COVID doing to our immune system? So after people get COVID, for weeks after it's over, for 4 to 12 weeks, sometimes more than 12 weeks, and 12 weeks is like 3 months. So 3 months after you initially got the virus, some people might still experience some symptoms like fatigue or tiredness, headache, a difficulty in breathing, and a difficulty smelling properly. And while we've heard of the last one a lot, not many of us expected to last these symptoms to last for so many weeks and months after COVID is over. And the main reason this happens is that COVID is this very vindictive disease. So it has this tendency that once it gets into our body through our nose, goes into our lungs, and starts causing this infection, it reacts with our immune system and causes this cyclone of issues. It's practically called a cytokine storm. Cytokines are the immune acting messengers of the body, going all over the place and inciting a huge response from our body. And the names of these are not that important, but it's, if someone was interested, they're happy to see. But what happens as the cytokine storm evolves is that we can have mild, severe, moderate or severe COVID as a result. And that's a big part of why when you are having COVID and your saturations are relatively within the 99 to 95% thing, but it's not improving, many times doctors will tell you to get a test called CRP. And it's a regular test that's taken even if you get admitted in a hospital with COVID. The CRP test is a measure of the inflammation of the body, and CRP is the kind of hormone that gets released when there's an infection going on, and it's the body's way of saying react, 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 get ready and fight this thing, right? So the CRP is coming up from there. And that's what is going to happen with COVID. And that's why the body gets so, debilitated with this infection. But what happens after that? Well, hopefully, if you recover, it should go down, right? The CRP should go down and all these other inflammations should come down. But the fact is that these don't always come down. And that is a big part of why some infections cause long-term side effects. And the side effects can be so varied. Inflammation can cause a whole host of diseases, from a more higher aging of the body. It can affect your heart, it can affect your lungs, it can affect your brain. It can cause, cancerous conditions. It can cause diabetes. So inflammation as a whole is a good thing when you're fighting an infection, but it's meant to come back down to normal levels. It's meant to go almost to zero after the infection is sorted out. But this particular inflammation, especially after some viruses, and we're seeing this with COVID, can sometimes remain at a level that is higher than it should be. And it can continue for a long duration of time. Now, inflammation being linked to all these diseases is well known for a very long time, and everyone has been understanding that this is a problem. But how do we prevent it? So there are certain things that if you are not doing, like eating unhealthy stuff, eating more junk food, being obese, if you're very isolated and you're stressed a lot, these all do increase the inflammation, because it's our body constantly being on the fight and not having the right nutrients and energy to stop it. And so that's why sleeping also is an important part, eating healthy, but a very big component is exercise. Now, I'm not going to go through these massive charts. I've shown you a bunch of pictures that are very detailed and have loads of words and numbers and names. I'm not going to go into them, but just suffice it to say that scientists have found that exercise training leads to a decrease in systemic inflammation. The body's inflammation response comes down if you're doing enough exercise. Okay, and that is how it happens. I'm going to show you how, and I'm going to show it briefly, right? So if you can see on one side of this, there's one picture where it shows what happens when you exercise, how the body's reaction is, and another when you get a severe infection. And the pro-inflammatory ones are more when you're getting infected. And these are the ones that tell your body to stay infected for a long duration of time. What exercise does is that it increases the inflammation very short, and then it increases the come down response, bring the inflammation down response. It instigates that response in our body. It instigates the anti-inflammatory agents that start to come in, that they're supposed to come in, but in COVID, they're not coming in as quickly. So that is why it's important to exercise, because the COVID is bringing the inflammation up, and the exercise, what it will do, if you're done with the COVID virus, we don't want you to exercise when you have the virus, But when you're finished recovering, if the inflammation is not going down, this exercising can slowly bring it down and reduce it to a regular level. But as for how to do this, as you're recovering from COVID or you're suggesting to a family member who's recovering from COVID, I'm going to leave that to Saddam. Saddam, can you just brief us about how we can exercise the best to get rid of this inflammation and take care of our health?
Sure, thanks for that. Well, as Doctor did mention that exercise does help you to get rid of the inflammation which has gone high during the virus. So there's a particular way, people. So even when you start off training, right? So even if a person with no COVID who's training, even if you load yourself too much, the inflammation remains high. When you do training, your muscles do get inflamed, right? And like the doctor mentioned, that your inflammation reduces during exercise. That's the case even if you don't have the infection. But during an infection, this is the major reason that you get back to life with exercise. This is like a healing therapy that you can use, right? But there's a particular way. You can't have a 10 pills of Dolo 650 because you've hit 100 degrees Celsius, right? So there's a way we take a prescription. The same way there is prescription for exercise as well. That's where exercise therapists or coaches come in play who have studied this stuff, right? So based on so when Nikhil told me about we're going to be using this as our main agenda to help people out to get back from COVID, there was simple stuff that came in my head that basically when people are hit with the virus and they're coming back, they can't really all they have to focus on is simple stuff, right? Getting used to movements. For example, if you can't move your hand, you get that done, get up, walk around. Your muscles are tight because you're lying down on the bed for a longer duration of time, right? So the way to approach this is, as you see here, as you all can see here on the screen, we have 4 stages, right? So stage 1 being what doctor did mention, that we are not supposed to be training during the virus. Obviously you cannot. So that is the stage 1, where we just take care of selves, try to be eating right, keep your measurements in place, of your using your oximeters, thermometers to see your temperature is in place, your blood oxygen is in place, you're breathing fine. And then comes stage 2, right? So in stage 2 is basically where you start off moving. For instance, you're good now, you feel way better, you're not bedridden, you can get out of your bed. How do I start moving? You can't just get on to a HIIT session and kill it all on, you can't work for like 30 minutes straight, right? So how do we start? First things, let's approach it this way. I'm lying down on the bed, so the muscles on the back are really, really tight, right? Considering trapezius, the back of your neck, right? Your lower back, that's another muscle that hurts, right? Then your legs, the back of your leg, your hamstring. These are the muscles which are normally active, right? Without you training, meaning when you walk, these muscles keep you upright, right? When you walk, your hamstrings are used. So these muscles are at rest for a longer duration, which are shortened. So the best way to approach this is starting off with, say, simple low level of stretching, right? So when we talk about low level of stretching, there are very simple movements that we have put in together, right? We'll be going to that and we'll be explaining what movements that you can start off with when considered low level stretching, right? And then you could slowly progress to say walking for say 10 minutes, and you cannot start off with going 10 minutes at a stretch, because of which you can break it down to 60 seconds or 30 seconds interval. For example, you start walking for 30 seconds and then take a break till you feel better, and then again go ahead, right? Because I've had patients who were really sick and they could not climb up a stair. Like they climb up one floor that would not even take 15 seconds, and they're really exhausted, right? And for this to be improved, you can use interval training. But again, this is after your low level stretching, where you're walking, you walk for say about 10 seconds to 30 seconds, take a break for 30 seconds, again walk for 30 seconds, take a break for 30 seconds. So this way you can complete a whole 10-minute routine, so that you basically increase your blood flow and activate your muscles to progress, right? So when you talk about COVID specifically, it does affect the lung, right? Mostly it's the respiratory part of it which is affected mostly, right? You cannot, your aerobic capacity is dropped down. Irrespective of COVID, even when you rest for a long time without doing any activity and you go for a jog or a walk, you would really get exhausted, right? You start panting, you can't really breathe. You start breathing heavy, basically. So we got to approach that part of it also. No, that will happen only when you start loading, meaning you got to increase that range of exercise or increase the time frame of exercise to get to that level where you don't really get exhausted when you're even walking for 10 minutes or 20 minutes straight. Now we have done body stretches, we've started the interval walks. Now next, what? The next way to increase your heart rate, increase your blood flow, and get your breathing a little high without putting a lot of stress on the respiratory system is strength training, right? Now, talking about strength training, again, we cannot load heavy muscles and do intense movements there. We can do simple stuff like, say, step ups, right? That is also a resistance training, meaning you climb up on a stair, climb back down, right? That engages your muscles, right? Which has way better contraction than just simple walking, right? That is a progression that we can see here, right? Now, once you start off with step ups, once you feel comfortable, is when we start using a little bit of weight. Now, this is what I would suggest for a person through, a lot of research we have done here. We found out that 1 week of this should get people going to progress, right? Now, after a week of this training, if you do not feel good, meaning your blood oxygen level drops down, or say you're really getting exhausted, that means we still haven't crossed that week 1 pace, right? Which is we are talking about is stage 2, right? So stage 1 is where we rest completely, don't get out of bed, or probably just be at home, isolate ourselves, keep clean. Then comes week 2 where we want to train. Stage 2 where we want to train, and we've done the stretches, we've done the interval walks, and we feel good now, right? Now, once we feel good is when we start including this resistance training. Now, when I talk about resistance training, it's basically using any kind of extra weight, like we did step up, right? That is a resistance training. Now, that is for your lower body. Now, you want to also engage your upper body muscles, right? Because they were also at rest. You want to get them back to functioning, because of which you could use very simple. Say, at Healthy Family classes, people who have attended my sessions, you all have an idea how do we do this, right? When we want to train very low, we just use a 1 liter water bottle or 500 ml of water bottles. That also causes extra contraction because you're pushing that extra load with the same muscle, right? So that is how we start increasing it, right? For week 2 is when you start using these lightweight for simple pushing, pulling, squatting movements. Again, these exercises we will show you once we finish once I explain you all the stages what we have come across here, right? So that is for your week 2 where we talk about resistance training. Now, there are people who be like, I'm not a beginner. I've been lifting, say I've squatted 100 kilos before, Saddam, and right now I can actually go on and lift a 40 kilo, right? And I'm not feeling exhausted. Even then, what studies have suggested is that we have to keep, say, heart rate, or the RPE. The RPE factor basically is rate of perceived exertion, right? This is how you gauge or see how intense your workout is, right? For example, if you've done a workout and a coach asks you how much do you rate this workout between 1 to 10 on exertion, you will know it was fine, it was 50% of hard work that I put in, and I can actually go another round. That will count that as a 5 RPE, right? To make it even simpler, what we can do here is you can keep your heart rate lesser than 60% of your maximum heart rate. Now, what is a maximum heart rate? A simple calculation, guys. You can note this down. You can use it further or remember it, right? You can use a simple number, which is 220, and minus it with your age, right? The number you get there, for example, let's take a 20 as an age, right? Now we minus 220 minus 20, we have 200. Now 200 is the maximum heart rate that a person will can reach during intense training. When I'm saying intense training, that's 95% of his maximum capacity, right? When you basically sprint at the maximum speed, that's where you'd be reaching. Your heart rate would be reaching at that rate, right? So now we're going to keep it lesser than 60%, right? So that comes down to around 140, right? 140. So again, when you have 140 as a number there, you obviously would not be using a tracker all the time. But right now, as you want to progress, and if you do have a device that tracks, it's brilliant because every machine now, the watches show you how her heart rate is. Now, keeping that in mind, you'll also, once you track it for say 2 or 3 times, you'll understand how exhausted you're getting at that particular heart rate. And then you can get that number to keep it at 130, 120, or 140, right? But the suggested study says that we got to keep it lesser than 60% of a maximum heart rate. All right. When you talk about even resistance training, try to squat 10 times, your heart rate shoots up, right? Check your calculators, right? If you have the machine, check your instruments, and you will understand what we're talking about in detail about this, right? Now, that is again about heart rate. Now, how about Saddam? I'm doing squats, bench presses, and I'm doing simple rows to work on my back, chest, and my legs, right? A full body pushing, pulling, and squatting. That's what the body does. And I'm working on all these movements, Saddam. My coach told me to do a full body routine. And how many reps do I do, right? So to start off with, perfect. So you can start off with, say 8 reps and do it twice a week, right? So just start off with, say, very simple momentum of 8 reps and do it twice a week, right? And then once you feel good, I'm sure some of you will be like, dude, I don't really feel exhausted here. But that's not the case. We're not exercising to get exhausted here. We're exercising to get fit for the future, right? It's always a goal-oriented thing, right? It's a lifestyle that you got to create for yourself so that you don't again get into the trap of any virus coming in, right? We don't know, right? I mean, however strong a person is, that doesn't really, the virus doesn't bother, right? It's not going to look at you and be like, hey, this guy is a strong person, I'm not going to go to him. That's not how it works. But keeping yourself strong will help the virus not work as much as it can in a person who is physically not active, right? Doctor has mentioned all the details in brief in the past. That will give us a fair idea of this again, right? So week 2 went on with a brilliant resistance training. We started moving weights, right, at 60% of heart rate. Now, this is the time. This comes week 2, people, right? In week 2, you can actually start off your aerobic movements, meaning cardiovascular exercises, where, for example, you could do simple jumping jacks. If you've seen your Healthy Family story today, I did high knees there, right? I put a simple aerobic movement and a strength movement, which is a squat, to tell you that aerobic and anaerobic movement, basically physical activities, will help you boost that immunity, right? There's no particular exercise. There's no one exercise or 2 exercises that helps you, but whole physical momentum, right? May it be strength training, may it be aerobic, anaerobic training, all of this helps you get there. Now, nutrition is an other factor, people, right? Talking in stage 2. Now we have progressed from 60% of heart rate training. Now we also started doing, say, aerobic movements. We can, instead of walking now, we start slow jogs or brisk walking or power walking, where you start walking a little faster than usual, right? Your heart rate is way higher than before now, right? And we maintain that heart rate. Again, we try to keep this aerobic training till our heart rate is at 60% for week 2, right? Now we start increasing it for the week 3. Keeping in mind, nutrition is a real factor. You got to make sure. Now, at Healthy Family, you have amazing nutritionists. You talk to them. I'm sure they will help you out with, your nutrition and nutrition needs based on what you're working, how you're working, on your physical aspect or your, health aspect as well. They work on all of that and then give you an idea, right? So nutrition, again, is real important when you're incorporating physical training here, right? Then move on to week 2 is done. Now, Saddam, I'm at week 3. Can I increase my weight training? Totally. This is where progressive overloading comes in. Now, talking about weight training, these are the simple movement that you could do, people, right? So here we have, say, bench press, the first girl holding dumbbells right over her chest, pushing the, anything pushing basically is a pushing movement where mostly your pectoralis, your chest muscles, your tricep muscles are engaged, right? These are the muscles that can get you functional. Moving on, we talk about the back because we're bedridden. Our back muscles are real loose now. More than loose, weak is the word. Real weak now. To strengthen that, simple rowing. That's a pulling movement, right? Pulling anything engages the latissimus dorsi, right? The whole lat muscle in the back, right? Most of the back muscles are engaged during a pull movement. Now, during a push and pull, different parts of your shoulder are also used. So it's a full body workout right here just by pushing and pulling, right? So this is another movement that you could do here, right? Then we talk about legs. We have a squat, right? And then a step up. I'm sure you guys have been working out for some time now if you've been with Healthy Family. Even if you haven't, these are the movements that you would have also seen in traditional gyms, coaches asking you to do, right? So these movements, if performed right, guys, there's nothing like it, right? You will start functioning way better than what it was before because we were at rest in the past. And now we have started off with, say, walking, stretching, and then increasing the heart rate to 60%. Then Week 3 is when we increase it to 70%, right? For example, if you could lift, say 10 kilos, you could press with a chest press. Now, how do we increase it to, how do we reduce it to 60%? 60% of 10 kilos, right? We start off with just 6 kilo weight or 4 kilo of weight, whatever that is number. The same number we start with. Well, as we progress to the next week, we're going to increase it to 70%. So let's take 70% off that 10 kilo and start training, right? That's how you can go on to your week 3. Now at week 3, what you can do is you can start increasing your aerobic workout as well, which is your cardiovascular movement, jumping jacks, high knees, running, swimming, right? Stuff like this. Now you can do this, you can start aiming for 30 minutes for 5 times a week, right? Again, here is where we increased our duration as well as the days we work, right? In the past, we were doing it twice a week, 2 times a week. Here we're doing it 5 times a week. And obviously, you've given so much rest after work where you will recover way amazingly because your nutrition also will be in place, right? So when you go to week 3, you can work on these single and multi joints like squats, pushes, pulls, right? And here you can increase your rep range to 8 to 12 reps, right? And you can also increase it to 2 to 3 sets, right? After this, you can also include aerobic training and keep it for straight 1 minute of running or 1 minute of jogging, 1 minute of cycling. Instead of doing 30 seconds break, 10 seconds break, you can actually increase it at week 3, right? Now, this is the proved method where you can incorporate training for yourself after an infection has hit you, right? Now, talking about stretches, there are very simple stretches. We'll go through it after this slide. So we had cat camel is the first movement, right? So the first movement, if you see the girl in blue, she's rounding her back. That basically is working on your whole spine region from the cervical, the top of your neck till the tailbone, right? You're rounding your back. You're basically flexing and extending your back, which was immobile throughout your infection. Now, that's the reason we pull in your cat camel here. So when you arch your back, look up, you breathe in. When you round your back, get your chin to your chest, you exhale, right? Now, there are different breathing methods also to this. The reverse breathing is also done where you hollow your chest, you breathe in and arch your chest and breathe out. These are different ways of training because big muscles are in the back. The studies have shown when you breathe in, when you hollow your chest and open your back, there's a lot more oxygen that is carried out in your blood, right? So again, you could use both the ways of breathing. You could do 30 seconds of this and then 30 seconds of reverse breathing there, right? Then talking about hamstrings, you could do a simple hamstring stretch. If you see the girl in light blue t-shirt, right? Sitting straight across and holding her legs and leaning forward, that stretches the back of your leg, right? So that is another muscle which will be real contracted. Now rest for a longer duration of time, get up and start walking. That is the region which starts hurting you. Now, if those muscles are weak, there are high chances you also get lower back pain, get problems in the hip, problems in the knee, right? That's the reason you start off with these stretches. Then strength training helps you strengthen those muscles to balance it out, to hold your joints as well. Then the person below that, you see a person holding his leg across his chest and pulling it in. That is for your gluteus, your butt. That's another muscle at your anterior chain, right? And then we have a quadricep stretch that you can also use. So that's the way, these are simple stretches and strength training movements that we showed that you can use, people. And moving on, if any of y'all have any questions regarding, anything related to health, which Nikhil will take care of, which is fitness, I will take care of, right? We're really happy to be here. So please shoot your questions and we'd be really glad to help you out with the same.
Okay. Questions wise, we got one. Tested positive on the 14th of April, says Ajay Nagpal. Had a fever in the range of 9900 and lost smell for 2 days. Tested negative on 30th. He's now doing about a slow walk of 6 to 8 kilometers a day on average. Is it okay? And by what time should he start running? So 14th of April was the infection and he had a fever for about 4 days. He's negative from the 30th of April. It's been about maybe 2 months, a month and a half. So what do you think would be best for them? When do you think he can start like actually doing his running again?
Yes, Ajay. So as I see here, like you mentioned that you've been walking already for say 6 to 8 kilometers, right? And when you say you're walking, you'll be walking at at an average pace, maybe, or you'd be walking at brisk walking or at power walking is what you're doing. Now, I would suggest you to start off with a jog, right? Let's not aim at 6 or 8 kilometers, right? Let's have a short time interval. So let's try to complete 3 kilometers with a jog, right? Now let's start jogging immediately. You can start off because it's been 1.5 months already. So you can start off with simple jog for lesser duration. Now we have long distance, so we'll reduce the distance and increase the intensity. That's what happens during training. You either increase your intensity or the volume. Here we reduce the volume, increase the intensity. When you say increase intensity, we're not going to sprint, but we start jogging slowly for 1 kilometer. See how you feel, right? If you feel great, continue for the second kilometer. If you feel great, continue for the third and stop there. Don't progress after that. Give it a break. Start the next time again. Keep that going for, say, a week, and then slowly next week you can try to add in a 500-meter more. Or, like we spoke, intensity or volume. Keep the volume the same and increase the intensity faster. Instead of jogging, start running now, right? And that's how you can incorporate running. So this is a good time. You can start off with jogs right now.
So you're saying that he can start with jogs in the right now, and he can slowly build up to running, but not try to run all the way
immediately right now.
sprinting
Yes.
for 6 to 8 kilometers. Okay. And to maintain his walking amount, right? So jog maybe a kilometer, but walk his regular 6.
Yes.
All right. All right. That's great, Saddam. And I think this question is more for me. Vivek Tyagi says that he wants to do a trek, a high altitude trek. He's been 3 months post recovery. So Vivek, we understand how you're doing. He's feeling absolutely fine now. He did 5 kilometers in 35 minutes. Saddam, how do you feel about that in terms of exercise, 5 kilometers in 35 minutes?
Well, that's actually a good speed. 5 kilometers in 35 is not bad. It's actually a good speed, meaning he is functioning fine.
Well, then
Right.
I
So
think that
a normal person, the fastest speed goes up to, say, 15 minutes, right? 15 minutes was my fastest when I completed 5K, right?
Okay.
Now talking about it, when I started off, 20 to 25 was it. So for recovering and completing 5K in 35 is pretty good.
Yes. So then I would say, Vivek, you can try it out. Maybe you want to try keeping your mask on while you exercise to see whether your lungs are able to take it, because that would simulate the effect of being on a high altitude trek. Because the high altitude issue is mostly there's less oxygen in the air. And that's why people at high altitude can sometimes feel faint or nauseous. And maybe because you want to do the trek, one of the best things to do is to go up there and at least acclimatize for 3-4 days. Standard procedure when you're going for a high altitude trek. Speaking from experience here, of course. Anyway, next one I think is from Sheetal. Saddam.
Yes.
What
breathing exercise can we do?
Yeah.
Yes,
yeah.
This is one pointer. I'm sorry, I really missed out on this one, guys. So breathing exercise works on the muscles which are inside the lung, right? So there are just not the muscles outside. There's muscle inside the lung that helps you expand and contract too, right? So some breathing exercises, but under supervision is amazing to train, right? So there are a lot of breathing exercises. When you talk about breathing exercises, there is Wim Hof breathing, box breathing. You go to YouTube, type breathing exercises, they train you n number of breathing drills, right? But it's always good to get help of a person who knows what he's talking about and how the breathing is affecting you in the body. And if you do have somebody like that, or if you are trained to do it, from stage 1 is good. But again, I would suggest you to start off from week 2 of recovery.
Right. Thanks, Saddam. We've got a question about tiredness and sleep disturbance post vaccinations. I'm just going to be clear about that. It's normal to have it for about 3-4 days. If you're having it for a prolonged period of time, then it's okay to go and do something about it, like speak to a doctor. If it's for the first 2-3 days, if you're feeling a lot of tiredness and sleep disturbance, get sleep as much as you can. But also you can take a paracetamol if you're having a lot of body pain or fever. I think someone is saying that they have, so this is Deepthi Krishna Saddam, who is saying that she has, she's been negative for a while. It's been almost a couple of weeks, still having pain in the chest, I think. And also her TSH is high. So the TSH being high, Deepthi, is a sign that you have hypothyroidism. So it's really good if you go and see a doctor for that. You can do that through the Healthify Me app, because we have doctors on board who specifically treat TSH, thyroid issues as well. But this is a really interesting question for you, Saddam, from Madhav Deshmukh, a pediatrician. He said he joined Healthify Me just a week back to lose weight. Is weightlifting necessary, and can't the same be achieved with aerobic exercises? So, Saddam, this is for you. I'm sure it's really deep in your zone, so go for it.
Well, I love this question because this is what I usually talk about to a lot of clients, right? So when you talk about aerobic movements, think of it this way: when we're running or jogging, you're using your body weight, correct? You're not adding on anything. So studies have shown that to improve performance, to improve your cell growth, which is hypertrophy, your muscle growth, right? So this is what we need basically to improve performance. Does not mean we want to be a high performing athlete, meaning you want to like breathe better, walk better, not feel tired when you're lifting anything from the grocery store, right? That performance. So if you want to improve all of this, you obviously have to train your muscles, right? Because your bones do not do the work. Your muscles do the work of lifting, climbing, running. So if you have been training with the same weight, so for aerobic movements help you for, let me tell you what aerobic does firstly. Aerobic movements increase your heart rate, increases your blood flow, right? Increases your lung capacity to basically breathe in and breathe out because you're training it at a high level where you're exhausted, right? So you're training in that aspect. But when you talk about performance or being healthy, it's always good to do strength training. Yes, weight training is important. But again, when talking about weights, you can start off with simple body weight movements, right? You don't really require to use heavy dumbbells or heavy barbells, but you can do, say, if a person is simply doing 10 squats in a tempo where you go 1 second down, 1 second up. To make it a little more intense or feel like you're lifting 5 kilos, what you could do is you could say, take 5 seconds to go down, 1, 2, 3, 4, 5, and another 5 seconds to come back up, right? That will also increase the load on the muscle. So talking about it, you don't really need high weight or weights to do weight training. You can do your body weight training as well and reap the same benefits if you're not looking for like particular goal like bodybuilding or like sports performance. But yes, weight training is essential for general people as well, because studies have also shown you have amazing bone density. Even when you're at 70s, 80s, a person who have been doing strength training has way better bone density than people who have not been doing strength training. So that way, yes, strength training will be helpful, except for the aerobic. Do both of it, balance it out.
Yeah, so then just to clarify before we move on, I think if I
Mhm.
remember right, it's also that when you're doing strength training, you build more muscle mass, and that lean body muscle mass really helps with losing weight. Is that there's something related to
Yes,
BMR? Your
yes, basic. Yeah,
Go ahead.
sorry about it.
No,
So
go ahead,
yes,
go ahead.
so you are answering it yourself, right? So basically, when you have a lean muscle, and so what happens is when you have better muscle quality, you have higher metabolism, which means you're already burning a lot more, right? Which means you are shedding fat, right? The calories you're pulling out of your body and the calories you're consuming, if it's balanced or equated well, the nutritionist at Healthy Family will do it for you guys. Talk to them; they're amazing. So yeah, if you have that in place, trust me, it does make sense. A lot of quality muscle does shoot up your metabolism, right? So shooting up that metabolism is the answer here, Nikhil.
Thanks for that. So just remember that increase in metabolism is also going to help in weight loss. Thanks, Dr. Deshmukh, for that wonderful question. Really, really important question for many people. This one is for me, Saddam. So there's a question on why is it that the severity of infection can be pretty bad even for healthy people? This is a question from Amarjeet. When they don't have any comorbidity. So, Amarjeet,
Mhm.
yes, different people have, some people who have comorbidities like diabetes, high blood pressure, cholesterol, and all that can sometimes have a much worse infection, especially because they're older people when they have these comorbidities. But people who are younger can sometimes have bad habits in the sense that they're not exercising, eating healthy. They may not be as healthy, even though they are technically not having a comorbidity, a chronic disease. So they might not be as healthy as a whole. So being healthy, eating the right food, exercising healthy, sleeping healthy, all these things are going to lead to your overall health. And even if you don't have a disease label, it doesn't mean that you're a healthy person as a whole. But as I've noticed, people who are healthy and especially COVID fit, which means that you're taking your vaccine and you're healthy from that perspective as well, they're the people who are least likely to have the infection. Again, the infection is a random thing. There's no perfect, like if I am doing all of this, I will definitely be fine. Everyone has different levels of health, and people can have different vulnerabilities as well from a genetic perspective. So I hope that answered your question, Amarjeet.
Um, there's
Yeah.
another one, doctor. There's a lot of them have been asking about post vaccination, right? So, do you
Yes.
want to just cover a little bit of what happens after you get a vaccination, or what can we expect out of it, or how do we go about it in daily life? Up, say it's just a day or two, and should I get back to normal activity? I feel a little dizzy and stuff. I've heard this a lot, so I wanted to also clarify the same.
So you're asking what is the things post vaccination, what can happen, and what are the effects on the body?
Correct. Yes.
Right. So vaccination can affect our body on multiple levels, but the essential thing of the vaccine is that it's sending a small infection particle into your body and triggering your body's fighting response and preparing it to fight the real virus. So
Mm.
it's actually sending in a small but important amount of the virus, inactivated, broken down, or just pieces of it that won't cause the actual infection. And in this is it's triggering your body's response to be able to fight back, to be able to be as ready as possible. Now,
Mhm.
obviously, it's simulating this fighting response, and this response can cause fever. After all, fever, body ache, and all these things are incited by our body. It's something the body does to kill viruses, because when the body temperature increases, the virus finds the place very inhospitable. It's just a horrible place to live in this body. It's a terrible body, like that's the thing. So the body is actually fighting back this virus. And so what the vaccine does is it stimulates, or it causes a similarity to that actual infection, but without the terrible side effects. So what happens is that you can get a lot of fever, a body ache, a lot of tiredness. Loads of people talk about tiredness, especially they're still trying to do their job every day
Correct.
while after having gotten the vaccine.
Yeah.
And from personal experience, I was pretty much knocked out for 2 days. I was sleeping for 2 hours in between work. Please don't tell anybody else from my company. But
Never
like
heard
in
it.
the middle, like 3 p.m., I was just like, I just ate in lunch, and it's like my body was like, it's like the day morning, whatever energy I had started to crash. I was freaking tired, and I just slept for 2 3 hours. And that rest and relaxation just after you get the vaccine is really important for your body to get back to its regular state. So also remember that keeping a good immunity will help your body react to the vaccine. So eating healthy, exercising a little bit. Now, when you're having the vaccine, there's so much tiredness. If you want to take a couple of days off and not exercise on those days, that's also fine. But once you start getting better from the vaccine, again, do the same building up steps as Saddam has been talking about this whole time. Build up your immunity again, build up your exercise again, and keep on maintaining your body's fitness and all that, right? And this is also true for COVID. So if there are days when you're feeling really down, really low post the infection as well, we talked about how these long COVID symptoms can be there. It's okay to take a day off, but make sure that you're not losing, like taking 3 4 days off in a row. And as a result, when you're taking too many days off, your entire body's energy starts to come down. Your body's fitness starts to come down, and when that physical fitness starts to come down, the next time you try to exercise, it becomes that much harder. Now, I think we cannot go before doing this, Saddam. Although we're not seeing in the chat yet, I just want to ask, what is this thing about, we were talking about this, and my own terrible habit. I haven't exercised for 3 4 days with the COVID virus, and I'm like, shit, I have to exercise, I have to get back. And then I do way too much one day, and then next 3 days I'm like, okay, I can't do shit, I'm not able to do anything. Can you please tell us what is this, and what should we do to stop getting into this bad habit? What's the way
So
out?
so what happens here is, so like doctor said, because I've given it a break, I'm going to do the 3 days work at once, right? That's not going to happen. Number one, you can work that much. So instead of, say, you're doing a chest and back workout that day, you have not done it for yesterday, you can do a leg, chest, and back today. But tomorrow, your body's capability of recovering those muscles will be very low, right? Because when you're training, say, less muscle groups, your body will be easily recovering them, but you're adding on more work to it, right? When you're adding on more work to it, you got to make sure your nutrition is planned that way. Now, you can't eat, say, 3,000 calories a day, and you can't eat 1,500 calories a day. You can't zigzag every single day that way, right? Your body will get confused yourself, right? So keeping it like we started off, if you remember, we started off with simple stretches and walking and jogging. So when you've taken a break after COVID, you can start off immediately with this third stage of movement, which was, say, we do 70% of our maximum weight that we start lifting, right? Where we do 10 to 12 reps of 3 sets. So if you start progressively overloading, you will have a sustainable and sustainable and a good result is what you'll see. Now, you're not supposed to be looking at the weighing scale, number one, because you reduce your water weight. When you reduce your carbohydrates, your glycogens go low, your weight will be less, right? But that's not an aspect that you can look at. No, if you want to look at a goal, look at your measurements, take a picture of yourself, right? Measure your arm, measure your stomach, and that will basically help you to know your progress. But again, to get that progress, consistency is the key. So when you want to be consistent, don't overtrain at day one, right? Start off with progression of, say, doing simple, like we spoke about it in stage one, what we do, stage two, what we do, stage three, what we do. Slowly, I would suggest you all to, sorry about that. So slowly, I would suggest you all to start off easy and then slowly build up. Now, what happens psychologically here, doctor will be the best person to explain us about it.
Well, also talking about the exercise thing, so many of us, when we've lost a lot of weight and we've not lost weight, like we put on weight, or we've, taken a lot of time away from our exercise, we feel really shitty, like our whole body feels heavy and tired, and we just want to get back. And also our body, especially if we're used to a certain level of exercise, maybe even just walking 5 or 6 kilometers, and we've dropped it out for 3, 4 days, maybe a week because of COVID or this vaccine, it can be so hard to get back. And we desperately want to, there's that energy that we've been building up for not having done it. And the moment we get a chance, we're like, okay, I'm going and trying to do 20 kilometers to make up for
Boom,
the
yeah.
last one, right? And the problem with this is that it causes what we call a rest overactivity rest cycle. And what that means is that we're taking this rest for like 3, 4 days a week. Then we try to do way too much in one day, and then we crash the next day. And then we have to rest for so many days more. And so the best way to do this is the way that, Saddam was describing, and there's actually a term for it. It's called graded exercise. Not only is graded exercise, which means taking it like as if you're in school, first grade, second grade, third grade, increasing it slowly every day, is not only better for your body so that it can recover and do better, but it also improves your ability to stay with the exercise day on day. Otherwise, it's so challenging to do that, So I think that's a really important thing to keep in mind, is that even if you're trying something new, like, people who are trying exercise for the first time or trying to do weightlifting for the first time, it's really good idea to start really slow, really light, and do minimal amount of it. And also try to find the kinds of weightlifting that is not bad for you. Coming to that, Dr. Deshmukh has come back again, Saddam, with a question about backache after doing weightlifting. Can you give a couple of suggestions for people who have a little bit of back pain for the kinds of weightlifting that will not impact your back?
Yep. So I would suggest you to actually do an assessment, or hire a coach who can do assessment with you. There are coaches at Healthy Family. You can talk to your fitness coach as well. So back pain problem may happen because of wrong posture while lifting, right? So when you're lifting anything off the floor, you try to, so imagine this is your torso. You try to engage your core muscles. Now, when I say core, it's just not the stomach, it's also the whole belt, right? So you engage this whole as a whole, right? So when you lean forward, you keep it straight so that your core muscles are helping you to lift it off the ground. When you have a rounded spine is when there's going to be bulge on the disc, or the disc is separating, which causes a lot of strain. Now, that may be just one reason, right? So everybody says because of heavy training or heavy weightlifting, I'm getting that pain. But engaging your core and strengthening your core is one way to get rid of back pain. right? Engaging your gluteus muscle, right? The butt muscles, that's another aspect. So when people have loose or weak gluteus muscles, you'll end up getting pain in the back. That's another reason. Now hip mobility, that's another thing. So I would suggest you to attend my mobility sessions on Healthy Family session on Healthy Family Studio. You'll have an idea of what I'm talking about, right? So being able to move your joint or muscle in an extreme range without a passive force, right? So when you stretch, you use your hand to pull yourself down, or use the floor to pull yourself down. We're talking about mobility. It's the strength of your muscle to actually move without using that passive force, right? So if you have less mobility in your joints, if you have weak gluteus muscles, if you have weak core, these are three things what may cause you a back pain. So it's always good to assess and see what is weak in you, right? So you can do a simple glute bridge stretch test, right? So what you can, I'm explaining it to you. I hope you get this. So you lie back, you lie on the floor on the back, and you get your feet on the ground and you get your hip up, right? Or you could just type glute bridge on Google and you'll find it, right? So once you do a glute bridge, you raise one leg up and stay there. Now you'll start feeling pressure on the front of your thigh. That's your quadricep muscle. Now, if you feel a contraction on the butt or and the quadricep, it's totally fine. That means your gluteus is engaged. Do it on both the sides. But if you start feeling the burn in the front of your thigh, that means your quadriceps are dominant. Then your means your gluteus are not firing, and that may be the reason where your back is hurting. So this is just one test. There'll be multiple tests we can do for your core, for your hamstrings, for your glutes, for your quadriceps to know what muscles are not engaging and not supporting for you to keep a posture to get rid of back pain. So again, strengthen the right muscle and you'd be good.
Okay, thanks so much, Saddam. I'm going to take two, three questions that are for me, but I'm going to keep it simple. In the meantime, you could just take the question about vitamins and supplements after that. So
Yeah.
one thing, a couple of things I'm going to explain. The one thing is about vaccination. The first thing about vaccination is that if you're not having any fever or body ache, it's not a problem. Different people react to the vaccine in different ways, and it not having a fever or body ache does not mean that there's something wrong with your body or that your immunity is not good. So that's fine. All right. This is from Nilima. I hope you're okay with that. Having not much body ache in this thing is still not a bad sign. You could still be getting the benefits of the vaccine. Now, the second question, which is actually two different questions from people. The first one was, if you're having a pain, sometimes people can have it in the chest, but some people can have it in their back when they're exercising, especially aerobic exercises, like Saddam mentioned, really strains your heart. So if you're doing a lot of walking, jogging, and you're getting this strain, also, by the way, I'm sorry about the lighting. My electricity is gone and so on and so forth.
We can see you clearly.
That's good. That's good. So going back to the thing. So if you're having pain in your chest, and you're having it in your back between your shoulder blades, that is chest pain or angina. It's a type of pain that's coming from your heart, where your heart is straining to do the exercise that you're trying to do. Now, many people who feel this chest pain or this back pain might say, oh my God, I'm having this pain, I'm not going to exercise. Now, that's not what you're supposed to do. If you're able to get this pain, slow down your exercise, maintain at that level, right? Or even bring it down a little bit so you're not having too much of the pain. After you finish your exercise, if the pain is persisting more than 30 minutes after you've started resting, that could be a problem, right? But if you're relatively young and you're getting this pain, if you're having it when you're lying down at rest and you're getting a pain, I mean, go to the hospital, that could be a heart attack. But if you're getting it when you're exercising, it's perfectly normal. Okay. You're straining your heart. You're doing something that's strenuous for your heart. So do it, experience the pain, and then finish your exercise. Maybe slow down so you don't have too much of pain. And when you're finished with your exercise, your heart will actually feel the pain, feel the burn. And just like where your muscles are burning, it will start to increase the capillaries to your heart. It will actually increase the amount of blood that flows to your heart and give it a better blood flow to your heart. This is one of the ways that you actually reduce the risk of heart attack. And that's why everyone who gets a heart attack is told to exercise every day, even through that pain, so that their heart slowly improves back and back to the best function. and also that the blood to the heart is improving. The amount of blood flowing to your heart is improving. And as that increases, your heart will become much better capable to take on more and more exercise. It will actually become stronger at exercising and the capacity will be better. All right. And anyway,
it's just
over to you,
like
Sudham.
so it's just the same as where we train our muscles and have those micro tears and it builds stronger. Same way
Absolutely.
goes for the heart as well, is what you say.
Exactly,
Brilliant.
because the heart, after all, is just another
It's a
muscle. So
muscle.
it
Yes.
functions in the same way. Straining it, but not too much, is going to be the way to make sure your heart also builds up that best heart fitness for yourself. All
There you
right?
go, guys. Broken-hearted people, let's get our hearts stronger now. Kidding. All
Yeah.
right. So I do have a question here about whey protein. Is whey protein going to help me recover my muscles faster after exercise? So any protein will help you. So what happens is, so for example, say you have to eat 60 grams of protein a day. It doesn't mean that you should have your whey protein right after your workout or before your workout. Throughout the day, I would suggest you, if you have 60 grams of protein to eat, I would suggest you to have 20 in your first meal, say 10 in your second, 20 in the third, 10 in your, split it, but have say 20 to 25, 30 grams max protein every meal, right? It doesn't really matter if you're eating it from whey, but yes, you would need a complete protein for your muscle growth to recover better, right? So what is a complete protein? What is not a complete protein is all a different topic to discuss about. We're not going to talk about that in detail. But yes, whey protein will help you because it is your muscles absorb them faster. It's easy to digest, right? That's why they separate it and sell it in different boxes, right? So yes, it will help you, but not faster or slower. If you have, make sure you have your diet in place and you have your proteins from different sources, and you're eating say 60 grams. If you have to eat 60 grams, you will recover the same way, provided you sleep well too, right? 6 to 8 hours is what's required. I would suggest 7 to 8 hours easily, but again, we're busy individuals. The 7 hours at an average should be good for recovery. Nutrition is important, but take your protein however you want to, just not whey. Whey is easy because one scoop of whey gives you 20 grams of protein, right? And you mix it with milk, it's yummy. It's a milkshake, chocolate milkshake, strawberry milkshake. We have all of that now. So again, right, the easy thing is it gives you 20 grams at one shot. Instead of eating like 100 grams of chicken or 6, 7 boiled eggs, you can just have a shake and you're done with 20 grams. That's why we have whey as a supplement, right? Always good to use natural food. But if it's not easy to add on natural food, use your supplement. So it doesn't speed up the recovery, but it does help you recover, yes.
Good. Thanks, Dam, for explaining that. And there's another question about what to eat before and after exercise. So I'm going to give you that, and then I'm going to take one last final question. Go on.
Yep. So talking about before exercise, you would need to make sure you have good energy for it. But again, you should make sure you don't overeat so that you throw up during your exercise, right? I have had clients who just had food and they've come to a studio HIIT session. They're like, Saddam, I can't breathe. I'm like, hold on, sit for some time. Then they go like, Saddam, I want to puke. I'm like, go puke. That's when you'll feel better, right? You can't help it. You drink a little water, suppress that feeling. Obviously, that's another way to do it. That's the best way to do it. And if you can't really tolerate it, you puke it out. So what to eat before a workout? I would suggest, if you are not allergic to any nuts, dry fruits are amazing, high in calories, right? They're dense in calories. So it will help you sustain the workout. If you have, say, 1 or 2 bananas, studies show that it will take you through a strength training routine, which will go up to, say, 1 or 20 minutes on an average. Again, researchers keep coming. Some people say bananas, 1 banana is good. Some people say 2 bananas good. So I would suggest you have a banana, have a few nuts, or you can have basically carbohydrates, people. A little bit of carbohydrates, a little bit of protein, a little bit of fat is what you need. So how do we maintain it? The high amounts of carbs, good amount of fat, little average amount of protein, because you're having protein every single meal here to maintain your daily intake, right? That is important. You can have a peanut butter and a bread. That'll also help you, right? Fats, proteins, and carbohydrates here. Now that is your pre-workout. What about post-workout? Right after your workout, it's good to have, you can have a scoop of ice cream or two, right? So what does this do? It'll as you work out, your glycogens are depleted. So having that will basically shoot up that your glycogens and will not make you feel tired, right? Again, you got to make sure you have good amounts of carbohydrates, rice, rotis, bread. This and your protein is mandatory because you have strained your muscles, they're torn, they need to recover. And we have learned this in school, right? Building blocks, proteins are building blocks. So You need to put those building blocks for them to do the job of building again. So now you know what to eat before and after.
Yeah. So I've got a whole bunch of questions. I'm going to try to answer them really fast. One on vaccination. So someone was saying that, sorry, not after vaccination, said that after COVID, they were having some yawning. Yawning can happen as you're very sleep deprived, or there's not enough oxygen in your body. So if you're having some yawning after having COVID, it's okay to just stretch and exercise a bit. And even if you're not doing a full blown exercise, just a little bit of stretching sort of gets the blood flowing, gets your oxygen back, expands your lungs, and you'll feel better. Another couple of questions back to that heart thing that I was talking about. Sachin said that he exercised this morning and he had some shoulder pain on the left side. Again, that's similar to the chest pain. It's the left arm is also connected to your chest in a way through the sensations. So if you're having left shoulder pain or left arm pain, it's probably the same heart thing. And as Dr. Deshmukh has come back to remind me to mention to everyone, if you're getting chest pain while exercising, it's important that it's not a full-blown heart attack. So if you're having severe chest pain, please stop exercising. If it's a mild amount of chest pain, is it okay to continue your exercise? But it's okay to have a little bit of it when you're exercising a lot for the first time after a long time. So if you're doing a jog, like if you were walking for a lot of days and you start jogging a little bit and you go up a little bit of an incline and you're feeling a little bit of chest pain, then you're like, okay, I'll jog for another couple of minutes and it's starting to come down. That's a good chest pain exercise. If it's a lot more, it's not a good reason to continue. And if it's a lot more pain, very bad pain, then you should really stop and reduce it. So I said, if you're getting chest pain, try to bring down your exercise amount till you're just on the edge of getting chest pain, but not yet. And that's going to be the best for your heart. Little bit, not too much at all. And if it's staying past 30 minutes of rest, run to the hospital. That's not a good sign at all. All right. Now, a few people have asked about high blood pressure, diabetes, and small changes in their D dimers, CRP, whatever. If your CRP is high, not high, but a little bit raised, your sugars are high, and your your BP is high, these kinds of things, it's not a reason to stop exercising. These are normal chronic conditions. They're going to stay with you for the rest of your life. What are you going to never going to exercise because of these? And the fact is, exercise is the thing that's going to reduce these back to normal. So if you don't have an infection right now, if you're not having a current ongoing severe infection or a heart problem or something, it's okay to exercise a little bit. Again, start slow. Do Saddam's method, start slow, build it up slowly, but please do get back to exercising in spite of that. All right. All right. So I think we've like
I just want to cover one last question.
Why don't you do one last one?
Real important, right? I'm going to do this as quick as possible. So somebody has mentioned that they're taking a protein shake and skipping a meal. Will it affect you in long term? About some gourmet supplement is what you mentioned. I hope you know who am I talking about. I can't get the question again. But yes, guys, do not skip your meal to just have protein. You don't need to do that. Calculate calories, how much you need, right? So to keep it simple, have a goal weight of yours. So for example, I want to be 70 kilos. Now convert that into pounds. Now convert that into pounds, say on an approximation, say we get 130, right? So you do 130 into 12. The number you get is the calorie you get for your calorie deficit, right? So you get, say, 1,500. That is the number you got to maintain. Now you got to eat good amount of protein, good amount of fat, cover up the rest of them with your carbohydrates to keep you at 1,500 calories. Do not miss a meal. Have your meals. Make sure you eat enough calories. Having less meals will surely, you will lose weight, but at the same time, health conditions, immunity, weakness, drowsiness, yawning, all of this will be a factor that you will experience if you miss out on meals. Don't miss out on meals. Have balanced meals because that is going to be sustainable. How long are you going to drink a protein shake in the afternoon when you're going out for a date with your partner or with your family? They're having beer and pizza. You don't want to miss that out. Come on, right? So have a sustainable diet and then make sure you enjoy it so that you don't have to miss out on life because of fitness and health, right? It's a part of it. It's not life, it's lifestyle, right? So use it. Then keep it sustainable. Don't skip anything. Have everything is what I would say. Balance it. Moderation is the key here. So that was really important. I had to open this up.
Yeah, in fact, one of my professors had a beautiful line about that,
Mhm.
everything in moderation, including moderation. Also go have fun, eat some junk once in a while,
Totally.
forget exercising once in a while, but also remember to maintain that for your own health. So do the good
Totally.
stuff and then have some fun too, everything together. But Saddam, I think we've had a great session. I think it's been lovely. I hope all of you have enjoyed this at home. I've had a great time with this and I've had some amazing questions here. So really love that. Thank you so much for that. Saddam?
Yep, it was amazing being here. I mean, I didn't even expect these questions to come up, and it opens up so many different dimensions altogether. More than a week talking about recovery of COVID, then we spoke about people with heart pain. We spoke about people recovering from different stuff. Man, it was amazing. I got to learn so many things from you, and sure the people here also did. Like Dr. Deshmukh came in and helped us with a few things. Right. So yes, these were brilliant questions. Didn't even expect them, but it would be amazing. We keep doing this stuff so that we can learn a lot and also share what we know. I'm glad everybody turned up. A lot of crowd was here. Real good to see you all, guys. I mean, I'm done now.
Yeah. Thanks so much. I think the recording will be available somewhere. Can't tell you where right now, but I'm sure eventually this is going to be compiled, maybe briefed a bit so that all the extra stuff that we've been doing and extra conversation is out. But hope you all love it. I hope you all had a great time. Sorry, we can't take as many questions as you've given. We've tried to cover everything that we could within the time that we had. Thank you so much.
Yep.
Love being with all of you.
All right, guys. Bye bye. Have a good one.
Bye.
Bye,
See
doctor.
you.
Thank you.
Thanks a lot.